SAMRI acknowledges the Kaurna people as the traditional custodians of the Adelaide region where our buildings are located. We recognise the Kaurna people's cultural, spiritual, physical and emotional connection with their land. We honour and pay our respects to Kaurna elders both past and present, and all generations of Kaurna people now and into the future. We acknowledge the other traditional owners who live across South Australia, with a special thanks to those whose lands we visited in the production of these videos. This video has been made for general information only and should not replace medical or professional advice. Speak to your health practitioner if you have any questions related to your health or medical condition. The South Australian Aboriginal Chronic Disease Consortium does not specifically endorse any medicines or treatments described in this video. Aboriginal and Torres Strait Islander viewers are warned that the following video may contain images and voices of deceased persons. Gestational diabetes is when you get diabetes while you are pregnant. Aboriginal and Torres Strait Islander women are at an increased risk. The hormone changes of pregnancy can result in high blood glucose levels, also known as sugar. When the pregnancy is over, the diabetes usually goes away, but you are at greater risk of type 2 diabetes as you get older. Sarah Davey is an Aboriginal woman from Port Lincoln. She is a credentialed diabetes educator and a registered nurse with the Port Lincoln Aboriginal Health Service. She knows firsthand what it's like to be told you have gestational diabetes.
So my name's Sarah Davey. I'm an Aboriginal woman from Port Lincoln, and I had gestational diabetes with my first child, my daughter, who's nearly 10. I had been a nurse at that point for around 10 years, but not working in any diabetes specific field. So it was a bit of a shock for me, my first group diabetes education session. We were all kitted out, taught how to do finger prick blood sugar checks. We had to do them every morning when we first woke up, 2 hours after every meal and at bedtime. And if we had more than, I think it might have been, this was over a decade ago, close to a decade ago, if we had any about 3 or 4 over 7, then that would mean that you were put onto insulin. And my perspective at the time was that was a failure. I think later in my pregnancy with my daughter is when I had realised that it wasn't my fault, that it was just what had happened. By the time we got to 38 weeks, my blood sugar levels had been perfect, which was really good, but we ended up going 10 days overdue and was induced. The labour itself was, first labour, but Ella was perfectly fine from a diabetes point of view post-birth. She was only a reasonable size.
Sarah worked hard to keep her blood sugar levels in the healthy range because she knew that the more glucose that goes to your baby, the more insulin baby makes. Lots of insulin and glucose makes baby grow too big, which can cause problems for you and your baby. Now in her role of credentialed diabetes educator, Sarah reassures women that some pregnant women are more likely to get gestational diabetes. It is very important that gestational diabetes is picked up early by going to your ultrasounds, having blood tests and seeing a health professional regularly throughout pregnancy. This ensures that it is well managed to reduce the risk to you and your baby. Let's hear more from Sarah now.
I'm very mindful when I provide diabetes education to my women that I'm caring for, that they are aware that it was nothing that they've done, that it just happens in some pregnancies, and the aim of the game is to try and keep the baby and mum safe now. Like with type 2 and type 1 diabetes, they can be very effectively managed, provided you're keeping in good contact with healthcare providers and you're doing self-care strategies. So for gestational diabetes, I know exercise is quite hard when you're pregnant, but even just short walks a couple of times a day will be enough to help. If it's prescribed for you that you need to take a medication to help with gestational diabetes, take it as prescribed. And definitely being mindful of the foods that you're eating, so increasing the amount of vegetables you're eating, drinking lots of water, trying to have a very balanced diet.
Learning about healthy eating for gestational diabetes and how to test your blood sugar level at home is an important part of looking after yourself and your baby. A dietitian and diabetes educator can help you with this. It can be hard to remember to check your blood sugar levels, but little things like setting an alarm on your phone and ensuring you always take your blood sugar testing equipment with you when you go out is a good tip. Sometimes medication is needed during pregnancy to help keep your blood sugar in the healthy range. Your doctor, diabetes educator, dietitian and Aboriginal health worker, as well as your antenatal care team are all there to help you manage gestational diabetes. What happens after my baby is born?
We recommend that following 6 weeks following the birth of the baby that the woman has a glucose tolerance test. This enables us to be able to see if the lady is now got normal blood sugar levels. It's also important that we know that if you've had gestational diabetes in a pregnancy, you're at increased risk of having type 2 diabetes develop later in life or in the next 5 years. And you are also more likely to have gestational diabetes in subsequent pregnancies. So linking up with your healthcare provider, whoever's providing your antenatal care, you will be able to access the testing that you're required. Having had gestational diabetes before and being Aboriginal Torres Strait Islander background, I know that I'm in an increased risk of developing type 2 diabetes in the future. So I'm very conscious of at least every year having a HbA1c, so an average of my blood sugar taken, which I get done through the health service with my health check. I knew how important it was to make sure that I wasn't going to be of an excessive weight, a lot more than my ideal body weight for subsequent pregnancies. So I was very conscious of not carrying too much weight on me prior to pregnancy, that I was exercising well and eating well, and that my health screenings before pregnancy were all okay. As a woman and as a diabetes educator, I would just encourage all women who are contemplating pregnancy or in a relationship where pregnancy might just happen to try and ensure that they are being the healthiest version of themselves by exercising and eating well and just keeping on top of their physical health for the sake of the pregnancy and then the child that comes from that pregnancy.
We hope you have found this video helpful. For further information and resources, check out the links on your screen now. The South Australian Aboriginal Chronic Disease Consortium would like to thank Sarah Davey for her contribution to this video. This suite of diabetes video resources has been made possible by funding from Country SA Primary Health Network.